Before we get into your story, I want to ask you about your experience with your mother's breast cancer diagnosis because it seems that's when you started to learn and advocate even for yourself for approach to long-term health and early detection. How did your mother's diagnosis impact your family and kind of what was your mindset at that time?
Yeah, so my mom was diagnosed with breast cancer in 2008, and one of one of the things that she really struggled with was whether to do a single or a double mastectomy. So she had cancer in one breast, and she really didn't want to lose her other breast, and so she really struggled with that decision. And eventually, the testing came back that she had like an 80% chance of developing breast cancer in the other breast. So she at that time decided to do a double mastectomy. And during this whole process, I was kind of walking through that journey with her as she struggled and then finally made that decision. And so I made the decision then. If I'm ever diagnosed with breast cancer, just take them both. Like I don't want to worry about it. I'm going to get a double mastectomy. No, no doubt. And so for me, I didn't expect, I mean, I kind of thought, well, maybe one day I'll get breast cancer, but I hadn't really thought it through for real. But I did make that decision when she was diagnosed. Yeah. So I started going at that point to her breast specialist, which, so it changed the course of my monitoring. So I wasn't just going to get a mammogram at my OBGYNs. I was going to a breast specialist, and they do a mammogram and an ultrasound as part of their screening. So I don't know if you want me to go ahead and just keep going from there, or if you want to ask another question. But that was kind of the beginning of how it shifted my plan.
Yeah. Um, well, go ahead and tell us about like that time because these were the early days of hereditary genetic testing, and it was, the Angelina Jolie effect with BRCA, I believe,
Mhm.
in those days, but it wasn't very well adopted. There were still um, limited payer coverage for hereditary cancer testing, but go ahead and tell us about the visit that led to your diagnosis, because at that time you were routinely getting, annual screenings, right?
Yeah. So, yeah, my mom did not have any genetic testing done in 2008. She had her surgeries and all of that. It when I started going to her breast specialist. I was monitored with a mammogram and an ultrasound. There were actually a few years where I didn't have great insurance, so I skipped a year going and always kind of did it with trepidation, but just thought, I'm being really careful. If I skip a year, it's going to be fine. Well, I'm grateful that in 2018 I didn't skip that year. I'm also grateful that I was going to a breast specialist because of my mom's family, because of my family history, because my mom had breast cancer, because the mammogram missed it. It did not get it. It was the ultrasonographer. The ultrasound picked it up.
Wow.
And so if I had waited a year or was just getting mammograms, if it had been another year before it was, you know, a problem enough for a mammogram to pick it up or for, to feel a lump, my story could have been very different.
Obviously, it was a sharp practice. You had the tech that was running the sonogram who flagged it, and that precipitated the whole diagnostic workup that led to it. Um, did they recommend genetic testing at that time?
So not quite yet. So so my appointment was I actually went back and looked on my calendar before we were talking so I could kind of remember it because I had some dates in my mind. But my appointment was on a Friday, and I was leaving on Tuesday to meet my husband in Colorado because he was out there for a big project, and I was going to be out there for like a month or two. I don't even remember how long. And so my doctor said, there's something a little funny in the ultrasound, and I'd like to do a biopsy. And I said, okay, can I do it when I get back from Colorado? She said, nope.
Okay.
And she did the biopsy while I was in the office. And she told me it would take about a week to get the results. and probably nothing to be concerned about, probably a cyst. And so Monday night, I got home from work and my phone rings and it's my doctor. And she says, "You have breast cancer." And I was like, "Oh, okay." And she said, you could probably have a lumpectomy." And I stopped her in her tracks and just said, "Will insurance pay for a double mastectomy?" And she said, "Yes." And I said, "That's what I want to do." And she said, "Okay."
Yeah.
And yeah, so it was in that conversation where she said, "I'm also going to recommend that you do genetic testing. I recommend that you do the STAT test, the quick test that would test 9 genes, what she called the kind of the big scary genes, like you mentioned, BRCA1 and 2 are in that STAT panel." She said, I want you to do that because we get the results back quickly and we can kind of see what we're dealing with. But I also recommend that you strongly consider doing a wide panel that, but especially because of your family history, a wide panel of genes to see if there's anything else, anything going on that we might not. I said that very badly. She recommended that I do a full panel of genetic screening to see what else might be going on with my genetic markers.